There's many different screens that you can use to assess for an alcohol use disorder. What you alluded to earlier about binge drinking, I think the CDC has put out clear guidelines that for women in one sitting, anything more than 3 to 4 drinks is considered a binge, and men is 4 to 5. That's also consistently drinks on average a day for people, so 14 plus drinks in a week. So that could be a good sign. Is my drinking from a numbers perspective falling into the risky category? Um, when we screen for alcohol use disorders, which is really on a spectrum from a clinical perspective, we look at alcohol use problems in the category of mild, moderate, and severe. And there's really 11 criteria that I think can be used as good potential red flags that if people in the past year have experienced 2 or more of these, it might be a sign or a prompt that it could be really helpful to talk to someone about your drinking, whether it be, your primary medical doctor or seeking out a psychologist or a psychiatrist. But what some of those indications are is drinking more than you intended or for a longer period of time you intended. So, for instance, you might say, I'm going to go out tonight and just have 1 drink, and you find yourself having 3 or 4. Um, Also, perhaps maybe you tried to stop or cut back and said, this week I'm really not going to drink, or this week I'm going to, only drink on Tuesday night. And you found that that was a real challenge for you, or a goal that maybe you couldn't reach. If you're noticing that you're spending a lot of time thinking about or recovering from the effects of drinking, that can be another signal or sign. If you're experiencing cognitive or physical cravings for alcohol, that can be another sign. Um, if you've noticed that alcohol has caused problems, so we talked about interference with functioning, that can be with school, with family, with work. Um, and if perhaps a problem has come up or alcohol's gotten in the way of something and you've continued to drink, that can be a sign that your relationship with alcohol is potentially problematic. Hillary spoke about something before that I think is really important, which is if you've noticed that you've decreased your engagement in other pleasurable activities, so maybe hobbies or interests that you used to have because of drinking, that's another red flag. If you notice yourself putting you or ones you love in higher risk situations, so like drinking or driving, maybe taking risks that you might not without alcohol. Blackouts are a big sign, even continuing to drink after blackouts. If you notice it takes you more to feel an effect of alcohol or to become intoxicated than it usually would. And then finally, withdrawal symptoms. So, for individuals that maybe have more severe alcohol use disorder, withdrawal can be very dangerous. I always tell anyone that's looking to change their relationship with alcohol, especially if they're using consistently, to consult with a doctor, because we do want to have the monitoring. But if you're noticing when you're not drinking that maybe your anxiety is higher or you're experiencing things like sweats or shakiness, that can also be a sign that the relationship with alcohol is becoming more problematic.